Welcome to CFP Distilled. My name is Dr. Simon Moore.
And I'm Dr. Paul Dillon.
We are co-founders of the review course in family medicine. Every year we go coast to coast across Canada and help residents and practice-eligible candidates prepare for the CCFP exam.
You asked for it, podcast. That's what people have been saying over the past year, so we're doing it. We're switching from YouTube to superstar podcasters.
Exactly. So this is CFP Distilled. What do we do at CFP Distilled?
Every month we take the CFP journal, distill it down to what you need to know when you're practicing clinical medicine, and most importantly, for the exam.
So let's dive right in and take a look. August 2022 CFP Distilled. Let's take a look at the most clinically relevant articles from this month's edition. We are here in beautiful sunny Vancouver.
Beautiful, and just as beautiful as the cover. I'd give this month's cover probably like a 4 out of 10.
We've got a rubber tire and some, for those of you listening on the podcast, you can't see it. We've got some
rubber tire looking through at barrels at a garbage dump in
rusted
Nunavut.
Barrels. Beautiful Canadian landscape being featured on the CFP Journal. And we've just been busy for the last several days working on our annual literature review. So what do we do every single year for the review course?
Look through all 105 topics, check for all the new updates, and then distill it down for what you need to know for the CCFP exam.
Yeah, so we're so excited to meet you at our spring 2023 courses. We'll show you all those literature updates, but right now we're going to focus on the CFP August 2022. What are some clinically relevant articles we need to know? There's 3 different topics here. The first one is acute otitis media, definitely something we need to know.
I could absolutely see this showing up on a CCFP exam. It's also something that's going to come up commonly in clinical practice. So the updated guidelines from Infectious Disease and Canadian Pediatric Society, looking at kids from 6 to 2 years old. When do we treat them? How long do we treat them? What do we treat them with, Simon?
Exactly. So those are the key things to know. And there's also going to be curveballs that we need to know, because what if they are allergic to amoxicillin, the first line treatment? What are you going to give them? The answer, cefuroxime. What if there is treatment failure? The initial treatment didn't work. You're going to give them amoxicillin clavulanate. And when do we just treat, and when do we do watchful waiting? So there's actually 3 criteria that you need to know, that you need to be able to write out on an exam and ask about on a SU, that you can actually use to diagnose acute otitis media.
So what are those things going to be? You're going to look for that bulging likely to perforate tympanic membrane.
You're going to look for an acute onset of symptoms. If you just see the bulging tympanic membrane with pus behind it and the kid is happy, well, no fever, no pain, no vomiting, no upset nature from all of these things, maybe it was an otitis media they had last month.
Yeah, so if they're in that 1 to 2 days, then you can do that watchful waiting. But if it's been 1 to 2 days, they're irritable, difficulty sleeping, then you're going to start to treat them. And how long are you going to treat them? 10 days.
Yeah, and just going back, the third key feature on diagnosis is going to be the effusion. So acute symptoms, middle ear inflammation, and symptoms. You need all 3 of those to diagnose acute otitis media. So, yep, you're right. Going on 10 days. That's the amount of time we need to treat. And what if you look in the ear canal or on history, you assume that the drum has perforated?
It's still treatment for 10 days systemically.
Exactly. So that's some key things to know about acute otitis media. Let's move on to the next topic on contraception. The next item to know.
Next item, let's explain it. Let's Nexplanon. This is how to avoid.
Hold on, that's a brand name. Can you use brand names?
You can use brand name and generic at the exam.
Okay, so if you prefer the generic, as I know you always do, you would use the term Nexplanon. Nexplanon. Okay, so it's etonogestrel or Nexplanon. One of the things that patients are going to ask us about and would make a really good sample is, should I choose the Nexplanon or should I choose an IUD? And this article really lays that out really well.
So there's a huge thing you need to remember for Nexplanon. There's no evidence for patients with obesity. They were excluded from the trials on it. But what did the trials say for those that were included? So the one thing that's really interesting for me is, and it's easy to remember because you're putting it in the arm, is people would get paresthesia or some numbness in that arm. So if you were to counsel your patient, that's one risk you're going to talk to them about.
So that's the most common side effect that happens during the installation, the implantation, and then implantation. So the next thing to know about are down the road. What are folks going to be complaining about, upset about? Because the satisfaction rate for IUD is about 80%, and for the Nexplanon, it's only about 66%. So what are they complaining about?
So they're complaining of amenorrhea, and
Acne.
Yeah, that was another one. And a discontinuation rate. So they actually stop using it. And remember, how long can you use it? It's only 3 years for the implant, then you have to have it removed, which can be tricky, and you have to have training before you do it.
Yeah, exactly. So I know that there's a training tool that you can learn how to implant these at home.
Yeah, to implant, they'll actually send you a kit where you can kind of go through, and now you have to be careful with this because there are sharps in there. I'll be honest, I was opening up the scalpel doing the training. Glad I did it at home because I nicked my finger. So I'm glad I used the training tool. They send you kind of a mini arm and you can put it in and return it back to them afterwards. So a great way to train yourself and then go watch one of your colleagues do one or two.
And last thing about the Nexplanon, cost versus the IUD, it's about the same. They say $310 for the Nexplanon, $370 for hormonal IUDs. But remember, the IUDs last 2 years longer, 5 years versus 3 for the Nexplanon.
Yeah, the cost is only a part of the picture. Remember, when you're talking to your patients, you want to be patient-centered, and you're going to have to say, well, you're going to come back 3 years or 5 years. So that's not financially accounted for, but that's more trips back to see you, more chances for complications.
Very good. And let's move on to our last article from the August 2022 CFP journal. We've got asthma. They talk about the 2019 GINA guidelines, which are phenomenal because there's a massive update. Like, it's a game changer for asthma. You absolutely must know this key change.
So this is part of some of the studies, the Sigma study that came out. So Ventolin, like, I'm getting short of breath because I'm so excited about this topic. But if I was just to take Ventolin for my mild asthma, is that enough?
Absolutely not. So if you've got mild asthma, the new guidelines that came out in 2019 say Ventolin plus a scheduled inhaled corticosteroid. So morning and evening flow vent, or if you want to make things easier, more convenient for the patient, and more profitable for the drug company, then you're going to be doing SMART therapy. That's combined single maintenance and reliever therapy.
Boom.
SMART, not like
Smart.
us, apparently. That's the name of the treatment regimen. And it'll make a lot of money for AstraZeneca if you tell your folks, just use Symbicort. You don't need 2 puffers.
Yeah, so this is interesting. So this article in particular looks at one point, and I know there have been studies that showing this, like long-term steroid use will actually decrease height overall. I think it's 1 or 2 centimeters over the entire kind of growth trajectory of a child. So you can use budesonide formoterol. You can use that instead of using that daily therapy with steroids.
So budesonide, the steroid, is in SMART therapy in Symbicort, and formoterol is the long-acting agonist, but it's also a fast-acting, which is why you can use it for a reliever as well as a maintenance. One final key point from the asthma article is they've got table 1 on page 595 about control, and they've changed this over the years. Definitely key history questions if you got a SUE about asthma. Definitely things to know on a SAMP about asthma. You're going to be asking about daytime symptoms.
Is it a maximum of 2 days per week?
Yep, you're going to be asking them, do you need to use your reliever therapy?
Maximum of 2 doses a week, and includes doses taken before exercise.
Exactly, and is exercise affecting your asthma?
There you are, physical activity, we want that to be normal. Exacerbations, you want them to be mild and infrequent.
And that one's really interesting because there's no set number for exacerbations, and that's intentional. They validated this control tool using history from the patients. If the patient thinks it's mild, then they're well controlled.
And no absences from school, no getting out of school for COVID or asthma, going to school.
Or work, and then the last one is 90% or greater of personal best of your peak expiratory flow. That's it for our August 2022 CFP Distilled. We want to say one last thing for us. We're really excited about spring 2023. Where are we going?
We're going to go Vancouver, Toronto. Is there any other city we might be going to? Because residents asked.
Calgary?
No.
No one asked about Calgary, but we're going there
Going
anyways.
to Calgary, but where else?
Las Vegas.
Las
We've
Vegas.
Had
Can't wait.
a lot of buzz, a lot of residents saying we need a destination review course. So after several years of running the course, we finally worked up to it. We've listened to the residents. We're going to do a Las Vegas course in January 2023. And there's an amazing promotion. If you take a look at the website, you'll see how you can go there for free.
Hope to see you there.
Signing off, I'm Dr. Simon Moore.
And I'm Dr. Paul Dillon. That was this month's CFP Distilled.
Take care.